We're live, it's not showing. Access to this feature. Well, where is the camera? Probably still on my old camera. It's one I left at home. There's one right there, but I'm trying to get it back to this one. Yeah, I know. I'm trying to find the camera. So I always use the other one. So it's no, my problem now is the camera. I don't have my pro camera. I'm trying to get it back to a regular camera.
Modern technology.
Yeah, it works.
See, I'm used to using mine at the church, but I don't have that camera with me, so I'm trying to get back. And it doesn't give me any choices. Oh, this is frustrating. Their audio is on, but it says I don't have access to the webcam.
Tony was just saying because we don't have the webcam from the county, you're not going to be able to get video. You're only going to be able to get
I
sound.
thought I brought one, and it didn't end up in my bag.
Okay.
I
So
had
you
it in the
probably
wrong
won't
bag.
get.
We're just gonna have to go by.
You probably go with sound.
Yeah. All right. Audio on, that's all. So, anyway, I thank everyone for coming. Several technical difficulties later, we're going to get started. This is actually a meeting of the Board of Supervisors. Our chair, Susan Smith, is here. Bill Jenswold's here. I'm here. I'm leading the meeting because this is in my district. Mile that way is Susan's district, and mile that way is Bill's district. So we all come into Forest City and represent you. There are people from all around the county. We thank everyone for coming in. We feel like this is some very important issues. We wanted to do it at night, so we had some good input. So we'll try to get started here. Oh. Let me get back to this. Running too many things at once. We're on full screen and there we go. Come on, get over there. There we go. Okay, so there's our agenda for tonight. We're going to talk about the EMS challenges and future of EMS, the overview and testimonials, the steps to take, possible options for funding and uses. Then we're going to discuss some opinions from the county residents, what you think about it once you've reviewed the information. And then we're also going to discuss with possible action, setting public hearings for declaring EMS an essential service in Winnebago County. So that is the one actionable thing tonight that we could get to. We're also going to talk about the American Rescue Plan Act funding. We're have an overview of that, how it works, and possible projects that will be in the queue if we accept them. Okay, so here's the current state of our emergency medical services. We've got a lack of a hospital in the county, so that puts us behind the 8 ball right away. We have to transfer so far from the get-go. We currently have 3 EMS services around the county, plus a paramedic service, which is a separate entity, and then under the city, and located within 1 mile of the county line, outside of our county into several counties. We've got a lack of volunteers, drivers, EMTs, and paramedics. We've got increasing wait times. It kind of varies from day to day, but we are experiencing higher wait times. On an average, in a year, we average 3.5 ambulance calls a day. Then you have some of those days where it gets a little challenging. There was one case where I know through testimonials, they could probably tell you that we had 2 ambulances out and they were waiting for another one that had to come from Hancock County. We've only got a small pool of available people to take the calls. And when you have a handful of people around the county that are covering all the calls, you're going to end up with burnout. So wait time is critical. You can have an accident like this and people are going to have to wait for it. We do have mutual aid as much as possible for the larger ones, and but the time is critical on many of these things. So the clock is ticking. It could only be a matter of time until we lose another valuable service. Ever increasing wait times. We need more recruitment. We need EMS system improvements. So before I get to this possible solutions, I'd like to hear from some of the EMS people in the county. Is Spencer here? Okay.
He's not here, but I think.
Marlo and Thomas are here.
Okay. If you guys want to talk from that end of it, what you're experiencing.
Well, just reaffirming the numbers that you have up there. It's busy business some days to cover calls as a volunteer, and having assumed the Thompson area, the city of Thompson proper is part of our coverage area. You talk about wait times, that adds a little bit of pressure on delivering quality service across our catchment area. And beyond, and just really relying on our neighboring service providers in the county to chip in and provide mutual aid when we can.
So I was curious on how you came up with the increased wait times, like how was that determined? Does that mean, like, if Lake Mills doesn't have a crew, obviously to get up there, is that where you got that?
Yeah,
Okay. And burnout, yeah, we lost Kim, we lost Mark, people who've been on for many, many years and are tired.
so yeah, the burnout factor is certainly there. We're having that turnover.
Well, I think it's not just burnout, it's people who have served, how long were you on, Mark? 34 years, you know, there comes a point where,
But that isn't why I quit. Because of the burnout. If I could, I would still be on.
Yeah.
But I understand what they're saying, was it was being very stressful.
right,
And we appreciate all the people that have served all these years and have retired from it, but, you know, we got to replace it. And it's getting connected with younger people to get excited about is really a challenge. So we got to figure out that and figure out a way to connect with those people and any other possible volunteers or people to work with it. The Armstrongs want to talk?
Volunteerism is way down. That's our biggest problem right now. I mean, I'm covering 400 to 500 hours a month, volunteer. And that's where your burnout is coming in. You have nobody new coming in. We've had one new member in the last year.
Any other EMS people that want to talk about their experiences?
Well, in Lake Mills, we have 4 EMTs that are covering 24/7, 365. And all of us have another job outside of EMS. I do work full-time in Clear Lake as a paramedic, but in my off time, I'm covering in Lake Mills. One of our other EMTs is a dispatcher. The other one works for Gold Cross in Albert Lee, Austin area. And the other one is, well, thankfully he's a retired school teacher because he takes a lot of call. We have, how many people do we have that will drive for us, Carol? 5?
Yeah, about 5. I'm one of the drivers, or I help in the back. For me personally, I can be thankful that my employer will let me leave and stuff. That's where we're seeing problems in Lake Mills. Maybe someone wants to become a volunteer to help out the service, but their employer will not let them leave the work. I don't get paid when I do leave. I have to punch out and stuff. So if I want pay, I use my vacation time for ambulance runs. So, I mean, I had 2 calls today, so I probably was at work for maybe 4 hours out of 10. I work 10-hour days.
It's a commitment.
Yeah.
Yeah.
And it takes someone that wants to help people. That's what it basically takes. It's not all blood and gore like everyone thinks it is. It's just being there to help.
It becomes a lifestyle. You have to have that commitment to help one another. Like you said, it's not all blood and gore. It's a lot of just common sense. And anybody can do it. You don't have to rely on all the young people. We had a guy one time that was in his 60s. He joined, became an EMT, and took an awful lot of call. So anybody can do it. If you tell yourself, I can't do it, you won't do it. You gotta try it. And it's not, you'd be surprised what you can do. For anybody, I would recommend that anybody give it a try. It's very, very rewarding.
And I think we could do a lot of good just with a few more people at each service. It just kind of fill in that gap we've got right now. I don't think we need big numbers to, help our problem, but, it'd be nice to have many more numbers. Right now, we currently have a new facility in the south end of town, the Career Center, and aren't they doing an EMT class right
Yeah,
now?
there's 2 people in it.
Yeah, we've only got 2 people registered in it. They usually don't take a small class like that, but they did it anyway, and I
It used to
appreciate
be-
that.
You had to have 12 in the class for it to go. And then it's dwindled down to 9, and then it went down to 6, and now they're at 2. But we need people that don't just want to drive. We need people that are willing to take the EMT class, and that is a commitment. That's a 6-month commitment, 2 nights a week, and then you have your practical testing and you have your written testing. But we need people that will do that and that will stick it out. We've sent numerous people through the class, and they didn't pass the written exam at the end, and then they said, to hell with it, they gave it up. Because it's not an easy test. It's not something you have to study, you have to put in the time, but people don't want to do that. That's been our biggest struggle.
Well, what is the incentive that maybe could be given? Because the EMS, EMTs, that's a thankless job.
Yeah.
They don't get to often probably see the people they transport. They don't get to see the outcome. They, in the last 2 years, have gone into probably some of the worst situations that they have ever probably imagined. And EMTs, healthcare in general, but we're doing EMTs, what have they gotten in the last 2 years? They've, excuse my language, but they've gotten shit on. What incentive is there to even bring anyone into the field? I mean, why put in that time and go through all that training and give up their family life and everything to have to take their vacation to go drive for a call and not get barely a thank you from people?
Yeah.
You guys, for you guys that are. I mean, I think I had to use an ambulance in the fall, and they drove me 2 hours, and thankfully I was awake and alert enough I could talk and carry on a conversation, but not everyone can. And again, what kind of support are they getting from the community, the county, the businesses that are employing these volunteers? I mean, honestly, I don't know if I don't know if I could ever do an EMT job or a paramedic job, but if I could, I don't know in this situation if I recommend it for someone with they don't get any benefit, they don't get thanks that they deserve.
There's been all kinds of legislation presented, trying to put some incentives into it, whether it's tax breaks or whatever else, but nothing's really come around. The biggest thing they've done so far is when they changed it in 422D to allow a county to actually, implement a levy tax to support EMS services. So far, Winnebago County, the only involvement we've had with it is we are helping fund the city and the paramedic service. We put $75,000 a year. We just upped that a couple of years ago to $75,000 to help their budget. And it's probably not enough. I mean, it's an expensive venture. And I know I've been told, whether I'm guessing it's true, that we have the lowest paid paramedics probably in the state. They applied for a grant and they didn't qualify because they were too low paid. And
It's across the board unless you're in Des Moines. At Clear Lake, I make $21 and some odd cents an hour. And that's low.
But how long have you been in it?
20 years maybe?
it's kind of sad that rate like that. That's Clear Lake, but Quick Star's catching up with you. You can work at Quick Star for a little bit less.
I could quit my job and go to Clear Lake Quick Start on 3rd shift and make $18 an hour.
And have less stress.
and have bonuses and, you know,
They have not nearly the responsibility.
Right.
I just think that the money is well spent to be a new volunteer for the Forest City Ambulance Service and get in and get involved under the direction of paramedic level people is, I think, a completely different experience and a lot more supportive than someone that might have joined Lake Mills or Buffalo Center, or the prospect of being responsible for total patient care and not having the advantage of having a paramedic triage, determine if it's a ALS or a BLS call and
Sure.
take the best course.
I'm not gonna stand up here and tell you, I know all the problems, I know all the solutions. I don't. But we started meeting in 2019, I believe. In the fall of 2019, we met for a few months and all of a sudden COVID hit. And we had to postpone our meetings for a year. And then we started meeting again. So all three supervisors have been going to these meetings and absorbing all this information and trying to figure out, 1 month we think, well, this might be the way to go. And then the next month we talk to Wright County administrator down there and, they've got a pretty good plan down there. Maybe that's the way to go. So
but they've got the hospital dollars to help.
they have 2 hospitals down there and it's a lot easier.
Do we, with EMTs, is it kind of like with other healthcare areas that Minnesota pays more? Is that something we have to worry about being so close to the Minnesota border?
Yes, but the thing is, if you get your training in Iowa, you are nationally registered EMT. And to go to Minnesota, that national registry will carry over, but you have to become licensed in Minnesota. But if you're nationally registered, you get the reciprocity. But yes, the Gold Cross pays their EMTs $24-25 an hour at the EMT level. Some of their paramedics are making $29 and $30 an hour.
So I think that's something we have to look at compared to some of the other counties around, that are a little bit south that, like that is so close to Minnesota, she could choose to go up there, yeah, but, and I know money's not everything, thankfully, otherwise we wouldn't have a lot of our, we wouldn't have any of our volunteers, but as we all know, money is something.
You've got a
We
cost.
$1.50 an hour doing calls. We used to get nothing, but we gave ourselves $1.50.
Yeah, when I was on, it was $3.35 an hour when you went out. You were on call all week long, but you didn't get paid like you went out.
So it's not about the money. We do make some money if we go on a call, but we'd rather sleep.
But I think if you're gonna open up opportunities and get more people into it, I think money might help, not big money, but at least some money to pay them to be on call or something like that. I think we can get into some of this. Any other EMS people that wanna make a point before we move on? We'll continue to talk about it, but I want to keep moving with this part of it. So possible solutions, we could increase funding to our current EMS services as they are. Possible wellness taxis. One of the problems, we can tie up a ambulance for quite a length of time out of the county by transferring somebody for something that's really not an emergent thing. So if we could come up with some kind of a wellness taxi to help those people. Fund campaigns to educate the public and increase volunteers and staff, maybe it's just an awareness and connecting with people that we have to do, whether it's in the high schools, the colleges, or in the community. The other choice would be to contract all EMS out of the county, like what Worth County's looking at, or they're already contracted to Mason City Fire and Rescue, and Lake Mills does cover part of Worth County, but the rest of it's covered by Mason City Fire. So those are some of the possible solutions.
We did have a call over in Northwood that we had to go pick someone up within city limits of Northwood to take them to Mason City, to take them to Mason City because they were busy with the fire call in Mason, so we do help even Northwood, the city of Northwood.
Forest City has fertile land down also. That would be interesting.
Right. So that's some of the, when we're 1 mile from the border with each of our services, we're overlapping into other counties and servicing outside of our county. So it's a burden in that respect. Okay, so this is the Iowa Code Chapter 422D I was talking about. I left out a lot of it. There's 4 pages of this code, but this is the brief summary of it. Upon adoption of a resolution declaring emergency medical services to be an essential county service, a county board of supervisors may offer for voter approval the authorization to impose any of the following taxes or a combination of the following taxes. So the first choice is called the local option income surtax. So the way that works, it's a percentage onto your, I think it's a 1% on your income tax when you file income tax from Winnebago County. So it's only on the people paying income taxes in Winnebago County. The other one is an ad valorem of property tax not to exceed 75 cents per $1,000 of assessed value on all taxable property within the county. So when I look at this is just my opinion. I don't know what these guys are looking at, but if you want a constant source of revenue, the second choice seems more stable. The income tax thing, we don't know. If we have a bad year farming, if we have COVID hit, we don't know if people are going to have the income to pay those taxes. So we're going to have a fluctuating availability of monies. And then jumping down to the revenues generated from these taxes shall be used for emergency medical services, and it kind of defines it out what you can use it for. And it's, when it defines that, it says, but not limited to. So it kind of opens it up as long as it's to do with the emergency services. The County Emergency Medical Services System Advisory Council would be established following the declaration of the essential services. We'd appoint an advisory council to sit down and figure out with the services, where are the gaps, what would we need to make this solvent and make it work for these services. I mean, what would it look like? Maybe, what would we be putting money towards each of the services? Would be, would it be all under one service? Wright County, they just put money to the existing services, and it seems to be working for them, but it's up to this advisory council to determine that. And it may be the advisory council might be bigger before the vote. And then after that point, if it passes, there's only going to be maybe 5 to 7 people on the advisory council that will administer the funds. The taxes for emergency medical services shall be imposed after an election of at least 60% of the voting public. So we have to have at least a 60% approval on it before it can pass. So your levy rate, and I'm talking maximum 75% or 75 cents per thousand. And why I did that, we can't exceed that by code. Wright County, they said, well, 67 cents will work for them. But like this last year, their valuations went up. So to get the money they needed, they only went to 63 cents. So that's what the advisory council recommended to the supervisors, and they levied 63 cents instead of the 67 that was voted on. So when I say 75 cents per $1,000 valuation, it's basically if you have a $20,000 house, you're gonna be paying 75 cents per 20 of the $1,000 valuation. And I'll show you a chart here that'll kind of give you some idea what those cost would be, because there's a lot of variables in it when you got rollbacks and commercial property taxes and farmland is another way of figuring, and houses have a possible homestead tax credit. So, so the levy rate will be determined by a recommendation of the EMS Advisory Council to the Board of Supervisors. The Advisory Council will determine needs of funding to accomplish intended possible solutions. So here's your examples. If you have a house that the assessor says is worth $100,000 valuation, that's your assessed value. And then more than likely, you would probably, if you live in the house, you would have a homestead credit. But if you don't and you're renting the house out, the upper number of $42.31 a year is what you'd be paying on the $100,000 valuation. Then with the homestead credit, it's $38.67 if you're living in it yourself. And then the example 2 would be a commercial business right along this highway here. It has a value of $106,360. There's a 10% commercial rollback that the state put in. So their valuation for taxability is $95,724 at 75 cents per thousand. That would be $71.79 a year that business would be paying. If you have 40 acres out in Mount Valley, this gets a little more complicated because every land's going to be different because it's valued on CSR rating. CSR is the crop suitability rating. And so Mount Valley has some land that's we call God's country, and it probably doesn't produce as many bushels for the most part as others. So they have this one parcel. This is an actual parcel of 40 acres. It has an average CSR of 54.29. The assessed value is $40,150. The taxable value after the state does their equalization on it, it brings it down to $33,739. So their taxes on that 40 acres would be $25.30 per year for this levy. And now what did that do? There's an extra line in there. I think that was from a previous one. Just ignore the $19. That wasn't supposed to be there. I had figured some things out. Then I went to the assessor. The assessor gave me feedback on it. Says this is actually what it is. I left the line in there that's not supposed to be in there. So example 4 would be 39 acres out in Grant Township, which is a higher producing area. It has a CSR of 80.94 in Grant, and so valuation's higher at $60,869. Taxable valuation is at $51,149 after equalization. And then you would be paying $38.36 for that 39 acres. So it kind of gives you an idea. If your house is worth $200,000, you can probably just figure double that number, or if it's worth $50,000, you can divide that in half. So it kind of gives you an idea how the taxation would work and how it would affect you. So looking at the general public now, the people that are listening to this, what's your thoughts on this? What do you think we should be doing? How should we be solving our problems that we have?
Am I to assume that the tax would go toward, is that going to be earmarked specifically for wage increases or incentives for?
No, that's up to the advisory council to decide. I can give you a sheet that shows what Wright County did. I can't tell you what we're going to do, but I can show what they're doing. They have a different scenario because they got 2 hospitals right there, and it kind of equates a little bit different. One thing that is different here is we have the 3 services, plus we have the paramedics. So we have to kind of put them in the equation too. So it all depends on what is calculated. We know it would go towards the eventual goal of keeping it going. It's not to get people rich. It's to
But
keep it
it's
going.
not for, our equipment is good, our space, our
Well,
infrastructure is what I'm.
it could be. In that formula, I don't know, Andy, you think I should just bring up that sheet?
What Wright County does is that for each one of their services, they provide them $70,000 a year in funding for the 3 services. Of that 70,000, 15,000 is for training, 10,000 is for equipment, and I believe 45,000 is for personnel. However, it just has to be in one of those 3 categories. So if Winnebago County or if the advisory council, if that's the direction they would go, there's a potential to make sure that equipment, training, and personnel could be in there. But at this point, it depends on what the needs assessment says, and then it depends on what the advisory council would recommend to the board of supervisors to take in front of the voters.
And I would guess it may evolve over time. There may be more need as things change, more need in one area than another area that, the focus could shift. We don't know. Costs are going up dramatically.
For me personally, I think, like say it's an extra $25 or $50 a year, it's really no big deal because I personally had used the EMT in the fire department. My personal opinion, that if someone complains about paying an extra $50 a year, something is wrong because you never know when an emergency is going to happen. So I think that it's not a big deal. I mean, when it comes to your life, it's worth the investment. It's just my personal opinion.
How do you pay for your ambulances and pay where you get in the $1.40 or whatever an hour when you're on call or whatever? Like, where's that money come from right now? What do you charge for an ambulance?
It depends on the type of ambulance run.
Right.
We can only charge according to what Medicare will reimburse, and the insurance companies were really kind of dictated
I looked
by
at those
that.
tables, yeah, so it's $300 some or whatever.
Well, it depends on the level.
Hour.
We've got BLS non-emergent, we got BLS emergent, we got ALS non-emergent, we got ALS
Right.
1 and ALS 2, and it's anywhere from $500 to $1,200, depending on the call. And it is all based on what you use for medications, what you do for interventions, and then we also charge per loaded mile. So for Lake Mills, it's $13 a loaded mile from when we pick you up to where we drop you off. I think it's the same, if I remember correctly from my bill from Forest City. It's $13 a loaded mile. And I don't know about Buffalo Center. Same.
So you're somewhere between 600 and $1 million, 600,000 and $1 million in the entire county. You have 3.5 calls a day is all of the services.
But now you have to remember, the majority of our calls are Medicare, Medicaid. We don't have a lot of the Blue Cross Blue Shield, and the reimbursement, we charge $1,200, but we'll probably only get $300.
I think it's important to know, being a not-for-profit under Chapter 504 is a public service program that we forgive a lot of debt. It's just part of our process to give back to the community under what.
Right. Well, I agree. That's all good. We didn't start there. We started with what you can raise the per thousand, valuation of everything, or you started there. I don't know where your base is now. And I do know that, in a metropolitan area, if you need 50,000 people to have one ambulance. And we're in rural Iowa. That's not going to change. There's only 10,200 people here in the whole county. So we shouldn't even have an ambulance. If we were in Minneapolis, we wouldn't even get one for a neighborhood that you're on. But that's not the reality. We're spread out over, several hundred or 1,000 square, whatever it is, a lot of area, whatever our county is. And so it's a big problem, but I don't think that the solution is going to come from, and I'm going to go make more popcorn, so I'm sorry about this poop on this whole deal, but so last week I was at a different conference here in this different thing, and the representatives were here, legislators were here, and I sent a message through Henry Stone and the other two to the governor, who they met with today. And it's not happening to this year because they didn't think of it fast enough. I guess I didn't get to them fast enough. But the idea is that like the volunteer problem is real. I talked to Marlo when we were moving snow. I was moving snow in the neighborhood, right? And it's not going to change. Like, and I recruited for the Guard for 15 years. Like, volunteerism is going down. It's not going to change. People don't go to church for crying out loud. They're not joining the Lions Club. They're not going to go join the EMTs. And then it's more than just, you know, Monday and Thursday nights or Monday and Wednesday classes. It's also Saturdays, and then you have to do your ride-alongs and the other things that you mentioned. And I just got on the school board. I considered that when it came out in the newspaper. Had you done a good job in the actual paper, it would have said that there was also 9 classes available, but that tag wasn't in the story. And so I looked it up myself. They meet on every Monday night. Fortunately, one of those nights for me every month is the school board, right? So I got to do that. But I'm not opposed to that. What I think the solution here, and what I told the 3 representatives and the senator, is this: that like you just have to make it so that I'm like, if you instead of tax, the opposite to me, it's not the tax is not the solution, and maybe it'll be the solution today or this year, but it won't be the solution for everything. But if you told me that I don't have to pay taxes on my income, I don't have to pay income taxes in Iowa. The governor's trying to get to 4%. Regardless, if that never happens, even better if she doesn't, because that's 7, 8, 9, 10%, whatever it happens to be. And my household, if I don't pay taxes, that's worth me being an ambulance driver or an EMT. And that would be the same thing. Your problem is volunteers. You're burned out because you don't have 40 people on your crew. We don't have a summit full of celebrating the ambulance, and have all your pictures in there. There's your small group, and then there's even the firefighters are down, and so it's the same problem. And that would be a longer term solution that you can't solve, because first of all, you're jumping over it. If you're going over to other counties anyway, what are we taxing for them? Like nothing. So we're just providing a service, and those cities aren't paying us anything, or maybe they do. I think before, this probably, you'll get to a point where you'll say, well, we're going to have another hearing on this. But my solution is just make it so that people who, if you volunteer for EMT or paramedic or firefighter, or you are, whether you're paid or whatever. And I told them to throw in teachers and police and the National Guard too, since they were down talking to the governor. But if you're volunteering for these things, then just make it so you don't pay any income insurance or any income tax in Iowa. And the governor thought that was a pretty good idea today. But unfortunately, we don't have our funnels coming due this week. So we'll see what happens. But that was my solution to this deal, because you aren't going to be able to solve your problem with bonuses. You can't run. How many's on an ambulance crew? 3?
2.
2? Just 2? Okay, so even if they were full-time and they were both EMTs, or one was a paramedic, even if the other one was just a driver, if that was full-time, that's $25,000 a year, $36,000 a year if they're an EMT, $35,000 if they're an EMT, $36,000 if they're a paramedic in rural Iowa. I don't know what it is in Winnebago, but that's what ONET says it is. So, how are you going to have a $50,000, $60,000, $70,000 crew working full-time in four different locations or 3 different locations? I don't know what that costs. I don't know what an ambulance costs. I tried to look it up. They want you to call and find out.
About $350,000
That's a lot.
for a brand new ambulance.
Yeah.
And that's with no equipment.
Probably a trade-in value and no equipment.
And
So,
the trade-in value is about 7.
right. I've talked enough, but that's my solution. And I hope that that's something that happens, but I don't think that you can solve it at the county level, because it's not just Winnebago County. I bet there's 93 other counties that are struggling right now in Iowa with the same problem.
So on that same line of thinking, I can tell you that doing any of this right now, you'll see after a little bit, this timeline wouldn't even start till 2023 budget year.
Right. So
it takes time to get through the process.
But in order to declare EMS as an essential service, it's got to be done at the county level. It's done at the state level, but they put it on the supervisor's shoulders.
So they can do the tax.
So we can get the funding for it, yes. But without them saying and without us doing this, EMS is not considered essential in Winnebago County, Iowa. And I don't know about you, but that's not acceptable to me. And I
I'm on your
work
side.
it.
I'm with you. It's a different way of solving the problem.
Yeah, but
Right.
this
You
is
want
what
people-
this
you're
is the
gonna
hand
tax.
we're
I'm
given.
saying you can not tax and it'll be a solution too.
But this is the hand we're given by the state and how they deem it out.
What does it take to get it declared an essential service? What has to happen?
You'll see it in a little bit on a slide. We'll show.
So I've got the same opinion. You can't solve it with money. Winnebago County has tried everything that you guys have done. You try to rub money on it, try to fix it. It's not gonna fix it. I mean, there's everything in this county, just, you try to throw money at everything. We try to hire more people, we try, and we as you, not me. And money, the 75 cents. So the 75 cents per $1,000 valuation ends up being really close to $500,000 in Winnebago County.
It's 477,000.
So it's very close to $500,000. So it's not close to 100,000, it's close to $500,000. And you're not gonna fix it, you're not gonna buy, and I'm very for that. I'm on the fire department in Lake Nelson, that's not why I'm here. I'm here completely on my own. I feel for the ambulance service. They struggle, they all struggle. The fire department struggles, all the services struggle. Money is not gonna fix that. Des Moines, Saylorville, Mason City right now, to be a fireman on the Mason City Fire Department, you don't have to be trained to be a fireman, you have to be trained at EMT level, and they will teach you how to be a fireman. And Mason City's struggling to get them to come to Mason City. Des Moines, Saylorville Township, all these bigger metro areas are struggling. So if we take $500,000 and when you say that the board might take 63 cents, Winnebago County supervisors in track record have never taken the bottom end of any dollar. They would take all. It's always as much as you can get. The county never leaves extra. I would bet you anything that if this votes through and you have the option to take 75 cents or 50, anybody in this room that thinks you're taking 50 cents is completely naive. That you would take that money. So you're gonna take the 75 cents every time. So right now to try to buy with the dreams that I've been told, to put a paramedic service in Thompson, Iowa, or an interim or temporary or whatever you're gonna do, you'd have to try to take $500,000 and to buy 2 ambulances, to staff. You'd have to have, if you use the Lake Mills PD's scale of how they do work, it takes 5 guys for a 24-hour shift. So if you're gonna try to hire that many people to live in Thompson, Iowa, Mason City can't get people to live there, Des Moines can't get people to live there. You're gonna have to hire a special person to be able to do EMT or paramedic, to be able to run the finance, to be able to run the training, to be able to run the department, to start a department from scratch. And that is 0 chance that's gonna happen. It's never gonna happen. You can throw as much money as you want, and it's never gonna fix it. Recruitment's a better idea, to try to recruit, and it is. It's down everywhere. And he said the same thing. You can't get, the Lions Club is non-existent. The Ikes are just about non-existent. The fire department struggles and begs. The ambulance in Lake Mills dwindles all the time. That's not because it's a bad service, it's because you can't get people to give their time away from their football games, wrestling, any of that stuff. So, and I know the slippery slope that it is to call it an essential service, and it is. It is, but it's a heart grab to get the tax evaluation. And it's not that I don't think it's an essential service, it should have been listed that for years. But if I tell you that I don't agree with the fact that you should vote through the 75 cents, I'm a terrible person because I don't think it's an essential service. And that's 2 separate things, right? I would agree. So but to do this and try to put all this money towards it and put the county in charge of it and to base something out of Thompson, because it's centrally located. Forest City has 40, what's in Forest City? 45. So 4,200, so dumb math tells you 42% of the calls would be in the Forest City area. Lake Mills is 2,200, so dumb math would tell you 25% would be in the Lake Mills area. Thompson has less than 400 people, which would tell you less than 4% of the calls would be in the Thompson area. So to put all of your efforts towards an area where there's no population would be a horrible detriment to the city of Forest City. And then with your 75,000 that we currently give to Forest City, once you start your own standalone paramedic service or EMT service, you yank the money from the city of Forest City. So the taxpayers want to pay Forest City plus your own separate one. So then as a Forest City resident, you want your paramedic service out of the town of 4,200 and to Highway 69 and 9 or Thompson. And that would be a horrible thing to do to the area of Forest City.
Okay, so just a point of reference, when you talk about Thompson.
That's what you want.
No, that was an idea that got brought up. And since that got brought up quite a while ago, we've met with Wright County and we kind of like their model there because they're just, They're just
But
putting
you can't
money.
base this on Wright County because we don't have the services that they have.
No, but
It's a good idea. If we had two ambulance services, that you could pay those ambulance services or the hospitals the money, it'd be a great idea to follow them.
but
But for us to follow that
but in
mold, we
looking
don't have
at-
those options. It's not a
in
good
looking
idea.
at the numbers in Thompson, yeah, you're right. It's not going to probably work.
Yep.
It would be nice, but it's going to cost a lot of money. I think that money, just my opinion, but I think the money could be better used around the county with the current programs we have and keep them afloat.
Yep, and the money,
We'll move on.
I think everybody's opinion is gonna be different the way that if I lived in Wright, I might be one person living in Wright, but with a cow, if I have to wait for 4 seasons to come to Wright, that's crazy. Second question, the way I understand it, would it work with this funding to use it towards sheriff deputies being able to use it, train the EMS? As typically they would probably be some of the first people. I understand they can't transport, they can't do the same things.
First responders.
But if I'm waiting in my yard because I fell out of a tree, I'd be happy that someone that's trained shows up and the ride can come.
When they go through law enforcement, the academy, they do have it's ILEA of their version of a first responder. So they do have some training there. But yes, they wouldn't be able to transport. And our deputies and our Forest City officers and Lake Mills officers do a great job at helping us out. They, they respond when they can.
We usually have questions there.
They usually are the first ones there, but when you really need them, they're not gonna be, because there's gonna be a law enforcement call somewhere else that's gonna hold in play for the medical emergency.
Yep.
It's an unrealistic solution.
it'd be showing up to a fire as, if you trained Hepperly how to be, he's a fireman anyway. If you train Hepperly how to be a fireman, tell him to show up in his squad car, he's useless. So a lot of things without that ambulance, you're useless. I mean, you make somebody feel good that you're standing next to him, but I don't think it's gonna fix it.
But I know we have had cases where they are the first responder and it took a while for an ambulance to get there and they're doing the CPR and trying to keep the person
I think
alive.
cross training would work a lot of places, and the deputies, I would assume on almost any given moment, are positioned quite well in our county to respond to the majority of the things.
Right.
I'm just saying, that staff you already have.
But you gotta remember that the deputies, they have a job too. And when you go to a scene, there's probably something else that needs to be taken care of. They are secure the area, and things such as that. So they have their priorities too. The way it is now, they do an absolute wonderful job assisting us or taking care of the scene before we get there, or before they get there. But they do have their job too. So you can only lay so much responsibility on them guys.
Yeah, I wouldn't
And they
think
do
that
a
was
great
being a
job.
solution, but more of an extra tool in the tool bag to help patch up this problem.
And they do help when they can, when
Absolutely.
they're available.
So I've looked at the chapter 422. I know the Iowa legislature passes what last July. Did they discuss a sales tax option instead of property tax evaluation? So you as a supervisors are bound by this and could not come up with a.
The only sales tax we have is the one we already have for local option sales tax.
Right.
And they're talking about that going away and taking it over too. I don't know, and kicking the money back, but we don't know how that's gonna work. But no, that's the only tool in the toolbox that we have for sales tax.
Okay.
You had just quoted roughly $500,000 from property taxes on residential homes. Have you figured anything for the amount of money available if you add in all the land from all farms?
No, this is on the total valuation.
That's everything. That's
Yeah.
the land and the houses.
That was at 650 million valuation or something like that.
Okay.
We're a small county, so pretty limited. Wright County, I think their target number was 587,000, something like that, every year. So it's about 110,000 more than what we could get. maximum.
Do you mind if I speak to?
Oh, go ahead.
I think Forest City is the only entity that is currently taxing for it. I don't believe Lake Mills or Buffalo Center does tax any for their services right now. Our service is funded independently, though the city has a levy that covers the paramedics part of it. So I kind of disagree with the gentleman from Lake Mills that because the city of Forest City has put that out there, and our budget for this has run right around $275,000 a year, that the city residents, property owners in Forest City are already paying a levy. So I have an interest in them already.
Which part do you disagree with?
That having paid, throwing money at it, if we have the paid paramedics that have benefits and everything, I think you're gonna have better luck having a few of them. And you guys correct me if I'm wrong, but we currently are down 2 paramedics. Everybody knows that. And Forest City's paramedics go all over the county. They are not Forest City paramedics. They are county paramedics, but they are mostly funded by us. Again, Terry said that the county throws in $75,000 a year, and then Leland, I think, gives us $15,000 a year because we cover both of them.
Does Hancock throw any at that?
We get a little bit from that, how they collect their county taxes down
Oh,
there.
the hospital tax?
Yes. So,
You give me 1 second. I don't mean at your, I think the Forest City service is a great service right now. I think that's the best thing the county has going on. I don't mean to take money away from your service. I don't mean, I'm talking county starting their own thing separately as throwing money at something. I mean, if we have a service that's well established, and Forest City's doing a very good job at it, Lake Mills relies on it heavily. The paramedic service, the ambulance service. I don't mean it's throwing money to a completely new separate generation of itself. I don't think it's a good idea.
No.
To enhance the Forest City service, I think would be a good idea. And I think to fix what you have between Buffalo Center, Lake Mills, and Forest City is a better solution than a standalone county.
and I've been going to these meetings for about 8-9 months now. That's how I see the direction going. Until this committee, whatever it's called, is put together, I don't think we have a clear vision of what might come out of it. But I personally see that it would be an enhancement of what is in Forest City with some kind of supplement throughout the county. I don't know what this looks like, but we've got to have better coverage, and it can't all come from the very south end of the county all the time. I think that's where the idea of Thompson at one time came up, is because it's more centrally located. But we have 3 great services with good equipment, and they're just short on manpower. I mean, they're being worked to death, those guys are, gals. How do we get there? I don't know. I don't know what the solution is.
So how's the recruiting process for the ambulance? Do you guys just post something online, or do you go like, with our department, I'm on the Forest City Fire Department, ours is just word of mouth. We go to people and we try to get people to come, obviously we don't post anything, but that's our problem, that's why sometimes we're short staffed or lots, Do you guys just do
all of
word
the
of mouth? Or do you do online stuff?
We've done social media, we've done word of mouth, we've taken out ads in the newspaper.
Because I know, like, for our department, how we got some of the new younger guys on is because I went out and I talked to the younger people, it's different, like, if they would have came up to me and, somewhere and said, hey, you want to join the ambulance? Well, I don't really know, he's not really my age group, doesn't know a whole lot about how it's going to affect that life, versus if you have a younger person come to talk to a younger person.
You call me old.
No, I'm not. It's easier to relate with like how they handle things. People with kids and stuff. If you have kids in that lifestyle, you can say that, you have time for it. You just got to make priorities.
Okay, and here's the difference. Okay, and I don't mean any disrespect to any fire department, but it's always been cool to be a firefighter. Let's join the fire department because that's a cool thing to do. And don't get me wrong. Let's join the fire department because that's a cool thing to do. And don't get me wrong. I love my firefighters. They've covered my ass more than once. But it's not cool to be on the ambulance service.
What can you make it cool?
We're trying, but I don't have
I
your.
think that's not much, it's scheduled easier to be on fire department.
And you don't have the commitment, the time
Yeah,
commitment,
no, you have the commitment, so per,
but not to the degree that you do
yes.
with the EMS.
So when you guys were full staff, you would run about the same amount of calls that we would run. We'd run 50 to 75 calls. So each group, when you were full staff, would run similar to your 300 some calls out of Lake Mills. So you would run, if you had a full shift of your 5 days a week and alternating your weekends, it used to be closer to what we run, but we can run those calls any day of the year, 365, to where you have to run a Tuesday. And that's the easier part to recruit fire department people, because you know that you don't have to take Tuesday, you don't have to take Wednesday, you don't have to take Tuesday day. So I don't think it's because it's cool. I think it's scheduling logistically easy
Well,
for me.
And that's a
If
great
you're a
way.
firefighter, you can leave town anytime.
Yes, 100%.
If you're on call, you're committed, you cannot leave.
Yep, and I think that's
Within 4 minutes of the building.
Yeah, and I'm not here against any ambulance service. I think they need more help. I think recruitment. But my big reason I come here is Worth County tried to shove the 75 cents down people's throat without a vote, and Winnebago County just about stepped on their toes the same way. That's not true, Terry. Shake your head at me as much as you want.
We didn't action anything.
If you wouldn't have been corrected, you would have.
Sure.
So don't shake your head at me, because that's a down and out lie. So Worth County had the same problem. They tried to push it through without the proper vote. They should have. So again, if there's still no people, if you get $500,000 and there's no people to do it, what good did the money do?
And it can be repealed through a petition. If it's not working and the people don't like it, there can be a petition that can be repealed. And it has an end date. That the maximum amount of years you can put on it is 15 years. And it's up to the advisory council to maybe recommend how many years are going to go out on that vote. Bern?
Yeah, I was gonna say, what money can do for you is we put a young man through schooling, years worth of schooling, he's a paramedic, so money can do some good things.
And we help with that.
Nice people to dump it. So don't say it's all bad, it's not.
No, and I'm not saying it's all bad. I'm just saying it has to be guided. It can't just be misguided.
Well, absolutely, they don't know the rules anymore, you and I do, but I do, can from experience tell you to send a young man to college, and he's a paramedic here, we wouldn't have it if it wasn't for that money.
Yeah. Yeah, if you
We
find
have
that
to
one young
thank,
man.
we have to thank the county because they paid a part in that too. The service paid part of his fee, he paid part, the city did, and the county did. And, yeah, we have a full-time paramedic.
I agree with you, that we're fighting, it's a big uphill battle out here for America, but one of the cities to get people interested in doing this. It's gonna be tough, regardless of what we have there. Times are changing, they're not gonna come back.
I think what Barney's talking about too is the times change. If you're a paramedic, you're ambulance service, you're a firefighter, work in law enforcement in any capacity, you're doing this because you want to serve people. And if you don't have that drive, no amount of money's gonna change that. But you do have to have the services and the infrastructure in place in order to encourage that and give people a comfortable place to do that service. So it's not money, but it's also not just recruiting necessarily. You've got to find the right heart for the right person to do this.
Or you have to have crazy.
The fourth bullet point is going to be relevant. We're got to a logic circle here. Volunteering, money. We're counterpointing those two things back and forth against each other. Bullet number 4 on your agenda is pretty relevant. That's not the issue. Move forward.
Okay. All right. Was there one more comment over here or?
I was gonna say that EMS to me is a public safety issue, it's a fire issue, it's a police issue. We need to have cross training. We don't need to reinvent the wheel. There's many more agencies, EMS agencies that are doing exactly what we should do. And I'm not saying cross training is the key, that's not the point. But I think the point is that we've identified there's an issue. We haven't done any research. We haven't done any analysis for research for the data points. How can we come to a conclusion? And I think the conclusion to me should be the vote. If it gets to that point in November, it should be the voters. But we have identified there's an issue. We need to do the research. We need to do the analysis give all the information, pros and cons to the voters, so they can make an educated decision whether or not they feel as a whole, the county decision needs.
Right. Those people need to come up with an alternative, if that's something that be the way to go, who's gonna come up with the alternative?
One more.
Go into the, like, what you wanna do about where centralizing or where the EMS should be. I mean, I see people all throughout the county and being that, yeah, I work here in Forest City and I know a lot of people in Forest City, my family lives here. Yeah, I don't wanna necessarily lose any EMS services in Forest City, but, you know, there are lots of people in Rate. And it takes a while to get up to Rate. And roads suck, as we all know, in the winter. Partners are out in the fall and spring on those roads. You know, I don't know if it's getting one centralized place or figuring out how to use the 3 buildings that we have. But I really don't think that you should limit it all to just Forest City. I mean, we definitely need to use Buffalo Center area or Lake Mills or have one more centralized area for the EMS than just keep them in Forest. Because it's not fair to the rest of the county.
Right. And that's why we've been having these meetings
Yeah.
around the county and getting those inputs from around the county. So I agree. So I think we're going to move on. Discussion with possible action setting public hearings for declaring EMS an essential service in Winnebago County. This is when I think we missed one. There it is. This is the one we were talking about, the timeline. If this was to move forward, the Board of Supervisors would set public hearings declaring EMS an essential service. So the first consideration of the resolution to declare it an essential service would be at the earliest, April 26th. And then you have to have at least 10 days separating the 2 meetings. And then you'll have a second consideration on May 10th. And then on the earliest you could consider the approval of the resolution would be May 17th. So it's an extended timeline just within that part of it. So if it gets to the point of approval of the resolution, then you have to immediately appoint an EMS System Advisory Council. And those are the people that through the summer would go through the information, work with the services, and analyze everything and see what is our solution? What it would take to keep our EMS system solvent and at least going forward. And they would look at all the opinions that have been given here. So then the EMS Advisory Council would need to report to the Board of Supervisors prior to September 6th, because that's the latest date to publish a question on the EMS levy to include in the ballot. You have to have it on the ballot by September 6th. And then the general election is when we would have that vote, and that would be November 8th of this year. We don't want to have any special elections and have to pay for that. We want to have it on the general election. And the question must pass with at least 60% of the vote in favor. And then starting July 1st, 2023, EMS levy would be included in the local taxation if it passed at whatever rate that the advisory council came up with. So back to agenda on item 3. Now it's up to the supervisors to decide, are we going to move forward and set those public hearings?
We discussed that it was important to set the public hearings so that the people would have a voice at some point. And that's the only way they would ever be able to tell us what they want, tell the county what they want.
I support it, and it's, I can see no direction to go right now, unless somebody has some infinite wisdom they'd like to give out to us. It's, Mr. Thompson's idea. It would be nice if we could get both going. To me, it's, if it's one of my kids that needs an ambulance in Buffalo Center, and nobody ever talked, I don't remember anybody ever saying about closing anything in Forest City. Makes no sense. This majority of the there's a big population here. If we added another EMT, and we would put that one in the middle of the county to minimize response times. And if needed, that one would also go to Forest City. It's just that Thompson is, it's just because it's in the middle of the county to reduce response times if we did something, if we put something there. That's just an idea. It's not something that's been set in stone. But right now, as far as I'm concerned, I would make the motion to set the public hearings for declaring EMS essential service.
So just to make a point, I am the moderator of the meeting, not the chair. The chair's sitting over there. So I'll second the motion.
So we have a first and a second, and possible action setting public hearings for declaring EMS an essential service in Winnebago County. All in favor?
Hold on. So if you're gonna set a public hearing, it needs to have a date and a time.
Right.
So
So we're gonna probably, you're going with the dates listed.
so it'd be April 26th, and then I need a time.
There, April 26th, what time? It's your motion, 9:15.
Yeah, I was gonna say, probably as early, 9:15 on April 26th.
I'll second that part of it. And then.
All in favor?
Well, are we setting the second
Can
one
we set
at
the
this
second
point
one
too? Because they're gonna be
Yeah,
published together.
So you want the people to be able to have their voice heard at 9:15 on a Tuesday? That's what you said?
But they can also send in their comments, which we've already gotten comments for this.
I'm just asking a question.
Yeah.
It seems like an odd time if
It
you
would.
really want people's input. 9:15
With
on
all
a
due
Tuesday.
Well, that's when we do
Trying
our
to stay
meetings. When would you like it?
I'm just saying that seems like.
And I'll guarantee you, if I could get it done for 50 cents, I would do it for that instead of 75 too. I don't like your accusations.
So all of these public hearings were,
As angry as you want.
so all these public hearings, we're having one next month in Buffalo Center that we have to schedule. We have one next month in Buffalo Center that will be a public forum that people can voice their opinions there too. This is all leading up to this. So they are all going to be in the evenings. And then there'll be one in Lake Mills in April. So prior to this, there'll be 3 meetings around the county that.
It was surely a question.
Yeah.
Are those other ones that you just mentioned in the evening?
Yeah.
The ones in Buffalo Center? and
Yeah, those will be in the evening.
Okay, thank you.
AJ?
I was just gonna say, I know it's a matter of convenience for the board to have it at 9:15 during a regular time. But there are some people who kind of got last minute notice on this whole thing and were not able to make the meeting here tonight, which is one of the reasons why we're obviously streaming this. Their voices are silent. This is the public's money. And as a result, they have a full right to be able to, while they're not at work, make the comments that are necessary. I understand it's a bit of an inconvenience, but I'd like to ask the board for a moment, since this does involve life and death situations, that maybe they might consider having these public hearings at a later time when people can come to the meetings and openly discuss and talk. I've been to public hearings where there are important issues that have been discussed and no one's there because no one can make the time to come at 9:15 in the morning. You're not exactly going to be able to get off work from Winnebago or Rembrandt or some of the other locations. Whereas in the evening, you would have that chance and opportunity. Yes, it's shooting craps, but at the same time, it gives people more opportunity to be able to do and voice the opinions that they need to make so you guys can make an educated decision as to whether or not this is right or wrong for Winnebago County.
You know, and I agree with you that they need to have the availability of the meeting. But it's also, we have elderly people that don't like going out after dark. So we have a large population in this county of elderly people too. So, you know, I'd be willing to have one of those meetings, one of the two readings at night. If you're willing to set the second one, maybe in the evening or
I
something.
think you should have the first one, and you need the second one, because you already have the temperature.
And would you, 6 o'clock on the 26th, was it?
Yeah.
Yeah. I'll amend my motion to make it, the public hearing at 6 o'clock.
And are you also setting the second one at a certain?
We'll do that one in the evening too, then, to
Okay.
make sure that, everybody can attend. We'll do that one also at 6 o'clock.
Okay, and I'll second this 6 o'clock amendment.
Where will that meeting be?
We'll probably have to have it here to have the room to house people. We can't have it in the boardroom. Is that okay with you?
Hmm?
So I'm okay with that. So you better, I suppose you have to vote on the amendment first.
Okay, so we have, a motion and a second. April 26th, right, as the first one. 6 o'clock here. The second meeting is also here at 6 o'clock on the date, what? May 10. To set public hearings for declaring EMS an essential service in Winnebago County.
So since his first motion had a different time, you need to vote on the amendment first.
Oh. So, all in favor of the amendment, say aye.
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 Aye. Motion passed.
Now you can vote on it as amended.
Great. And so all in favor of the amended, all in favor, votes, say aye.
Aye.
And motion passed. So hopefully that will make it easier for people to come and discuss and talk about it.
Can I make a suggestion for the next meeting? My name's Holly Brink, I'm the administrator at the care center here in town. And I would probably guess if the EMS people will tell you the care centers in Winnebago County are probably your most frequent stop places because of the quality of the care that's needed there. So have a big investment in what moves forward here. And what I'm hearing from everybody here is that everybody wants quality EMS services. Nobody wants to mess around with health, whether it's you're having a heart attack or you have a child with a broken leg. We all need quality services. What I feel could be beneficial to the community is at our next meeting is a little bit more of the why. So what was presented this evening is that the problem is that there's not enough EMS service personnel. And somehow that has translated to a levy tax without maybe putting in some of the why. Why don't we have enough EMS personnel? Because I think we all agree if it needs to be money, then we need to look at money. But as an employer, I'm sure anybody who employs employees knows that it's super hard to find quality health. And a lot of people are just jumping at paying more money. But as we've heard in here tonight, the most people go into caregiving and or healthcare to help people for multiple other reasons. So whereas money, we might need to do a wage analysis. Has a wage analysis been done for EMS in rural communities?
It's hard to do a wage analysis when most of us are deemed volunteer.
So then, okay, so but what you're saying though is then they're not being paid, correct?
Correct.
But what we're asking is to get money to pay non-paid people. So just where the money would go from the TAP, the $500,000, I don't think anybody would be not in favor of doing that if they knew where their money was going and what for. I mean, we're essentially trying to pass
And
a vote
that's
on-
going to be kind of difficult until after the advisory council makes the determination. You know, we could guess.
But wouldn't it make better sense to have some, like an action committee to come up with what the core is? Why aren't we getting an EMS people? Is it not a good benefit package? Is there not enough hours? Are the hours, I mean, I've heard a lot of things tonight, that the hours might be too crazy. I personally choose not to volunteer for EMS because of the commitment. So how can you make the commitment less? How are we advertising it? What are we gonna do? So I feel like we're kind of chicken before the horse, like, let's give money to something we don't know what we're giving money to.
Just so you have the background, we have been meeting for months.
And that's something, you probably have all that information, but I think it'd be good for all of us to know.
Right.
What
We haven't
kind of
found
doing
the
plans.
answers, but we haven't found the answers yet. You know,
They
talk
don't
about
have
it.
to decide, it's the advisory board, which it doesn't exist yet. So-
Right.
But I think what she's saying is to have a recommendation of where that money would go before you ask for the money. Rather than just, it was a thought, it was an idea, Thompson isn't the thing, it was maybe possibly, but not going to, would go before you ask for the money. Rather than just, it was a thought, it was an idea, Thompson isn't the thing, it was maybe possibly, but not going to, but it's central. Option, you were gonna say fictitiously, you're gonna give Lake Mill and Buffalo Center some money and you're gonna enhance Fort City's department. Rather than just, we need the money, then we're gonna try to figure out what we're gonna do with it. That's a lot of the trouble that everybody has.
Yeah, I agree with you. It seems relatively backwards. Iowa Code, once the supervisors consider the resolution, that will be published in the paper twice and then a third time, and if they pass it, then the advisory council is, they appoint them, that advisory council has to do the needs assessment. So that's what, in code, that's what they're tasked to do. They have to go and do that needs assessment. Whatever group that is sits down with the ambulance service to get that final. So we're talking about unknowns, to be completely honest with you. That's the frustrating part, I think, for all of us, because I don't think anybody in this room, we could stay here for a week and nobody's gonna have a good idea. I'll tell you that. We've been doing this for months. But the reality is, it's so multifaceted that we need to do something, in my opinion as well. Don't know what that can look like in the end. That's where you have to meet with the ambulance service and say, what are you gonna need to fix your problem today? Or in the short term, you know, whether that's 18 months, 24, 12, I don't know what that. So those ambulance services will dictate that. We'll see if it's feasible to come up with a system that may not be the same for each one. Fort City might need something different from Buffalo Center, from Lake Mills. And to come up with what would that cost, if anything? And then that's where that advisory council would come back to the board of supervisors and say, we need X amount of dollars, so this levy rate is what we suggest. Then that question goes on the ballot. So there has to be an assessment process by code. So that's the frustration, I think, for everybody. And I guess I want to recognize that, is the idea that we're talking about the what ifs, and there's no what ifs to consider at this point. The resolution needs to pass.
The resolution is passed.
What?
I said, there is nothing, there's no need for the advisory council until that resolution is passed. And that's because that's how it's set up in the code.
And the one thing about the resolution, it's only gonna do any good if the vote passes. If the vote fails,
We're done.
then it's null and void. It is not an essential service, so.
But what the advisory council could say is that, yeah, we think this can work, but maybe we only need 30 cents. Maybe we only need 40 cents. Maybe we can make it work good. We don't have to go to that max.
I put 75 cents up there because that's the max. That's the maximum effect you'd have on your taxes.
Because that tax levy is not up to the supervisors, it is up to the advisory council
Yes.
to tell them this is what will work for the services in Winnebago County.
So what
The
I,
advisory council would still have to, they would give a recommendation, you still have to vote
right.
on it. So essentially it would come up to you, they would
Well,
advise you on
they-
your opinion,
they're-
you still have to vote.
They would send it to us budgetarily, is what it is.
As a
Yeah, but you can decrease it or increase it on your budget if you want. So essentially it would come to you guys.
They can reject the proposal from the council and have you go back and reassess. So yeah, you're absolutely right. The supervisor
I'd like to hear
ultimately is responsible. Supervisors are ultimately responsible for that loan.
So the point I was going to make is what you're looking for probably won't be available till September. And we'll still have a couple of months before the vote that we're going to come out and educate the public on what the advisory council came up with. So it's a little premature for those details. We could show you what other counties are doing, but it may not fit our county. So,
And it's about a timeline.
yeah, we have to meet this timeline to keep it moving forward. All right, so
I know it's kind of a ways away, but how are you going to appoint this council?
well, we look at the makeup in other counties, what type of people are serving on it, because we want the best people that will look at it in a fair and balanced way.
So I know you already passed those dates, but how were those dates decided? My concern here is the timeline between May and September and then the election. I mean, this advisory council's got a huge task in a really decreased amount of time. It's a done deal, I suppose now. I pity what they have to do in that amount of time and then to try to convince the public, you know, why the levy to be a thing, but.
Well, the other solution is to put it off several months, pay for a special election. And
Right, no, I'm not, yeah.
Are any counties using any consultants? That, I mean, like, this is their job.
I'm sure there is.
I find that a lot of times when we appoint people that it's not, I mean, my job isn't to work on ambulance, so I don't know what your core issues are and those sort of things. And you have people who have says in matters that maybe don't have full pictures of what it actually looks like. So having a consultant agency come in who specializes in some of these things could be beneficial for, especially that timeline that you mentioned.
And I think the advisory council probably has to live within the county, but they can utilize consultants probably to help them through the process, I'm guessing. We'd have to figure out the budgetary part of that, but maybe that's in our next agenda item. I don't know. We'll see.
I already have a solution. Everybody puts their name in a hat here and who gets drawn joins the service.
And commits.
Plain and simple.
I like your idea. That would make our job easier. All right, so we're gonna move on. Agenda item 4, the American Rescue Plan Act, ARPA. We're gonna discuss the overview of federal funding. So through federal legislation that they got passed, we were included in the funding at just over, I don't know, what was the number, 1.06 or something million per year. It's just over $1 million per year that we get. So our total funding is just over $2 million. And when it first came out, the original guidance was kind of gray and vague and scary. We weren't sure what they were trying to tell us because anything federal seems like it has catches to it, and we're not sure if we're going to get busted and have to come up with tax dollars to reimburse it because they aren't going to accept it. But then they came up with follow-up guidance and kind of opened it up more. And we've gotten some guidance from our ISAC and NACO, our state and federal organizations that has several uses that fit a lot of possibilities. So some of the projects on our radar so far, public health has a real problem with a shortage of space. And we'll talk about that in a little bit. And they would like to have a drive-through for vaccinations and COVID tests and things like that. The Nature Center project, as you all know, went out for bid during COVID, and it was over budget and not affordable at that time. We're looking at possible infrastructure purchases to support EMS. It is an acceptable expense. We've got scanning important documents in the courthouse. When we went through COVID, there was a lot of things that started going online, whether it was land records or minutes or I don't know what you have in your office that you need scanned and make it accessible.
Transfer books, flat books.
Yeah, so
minutes.
So that's one of the things we're looking at. It's probably a lower dollar item one, but something that is needed. And the replacement of the heating and cooling systems in the courthouse. They're antiquated. They're starting to get to be a burden. So here we've got public health. That's our current building. It's 2,400 square feet, no basement. It's a tight building. It's efficient, but it has no space. You want to talk about your nurses and what they go through in there?
Currently, I have 2 nurses per room, and with COVID and the mitigation, they have to be separate or 6 feet apart, and they're less than 4. So when I have a full staff there, if someone gets sick, we try not to have everyone there at the same time. I try to have only 1 nurse in a room at a time. Need that person be working, the other person be working at home. And just in this last 2 months, I've been very short staffed because they all have fallen sick. We're trying down to a minimum. Let's say our front office, our lobby area is really small, so we can't have people just come in, so they have to have an appointment for either really small, so we can't have people just come in, so they have to have an appointment for either immunization or vaccines, to pick up radon tests or anything like that. So I would like to have the building be expanded if it could be. So I don't want to mix the sick people in with the healthy people, so I would like to add on, and then we could possibly do drive-in COVID testing and immunizations, and so that they're in a separate part of the building.
Okay, so that's that
Plus,
part
our
of it.
treatment room is rather small,
And your meeting room's rather small.
and our meeting room is rather small.
So you also rent space on Main Street. You've
Correct.
got 1,320 square feet. Do you have all of the 1,320, do you know?
I believe so.
Okay, on one level.
On one level,
There's
yes.
housing above it, that's beside it.
Right,
So you have healthy families and a sanitarian and storage up there.
right. And then
So,
that, they could be moved down to us. It would take off spending money up there
for heat
for
and
heat,
electricity
electricity,
and rent.
rent.
Oh, wait a minute. Is that all I had? Yeah, that's all I had there. Anything else you want to add on that?
I would like to, with our existing building, we do not have automatic doors. When the elderly come in, they have a hard time opening that door when they pick up their equipment or their radon kits or they come for whatever. So that is a one must. I would really like to be considered to have that done if they go and remodel this building. Or if they build somewhere else, that is, I believe, a must that we have it so they can get in and out a little bit better.
We do have availability of space next door from another owner, but it is tight. So we don't know what an architect would say about utilizing that space and still having a way to drive around there and park. We're limited on parking there. We have the Methodist parking lot next to us that we've been using, but not sure how that's going to work into it. So we would entertain all solutions to solve our problems, whether it's another facility we could renovate or just adding on here. We don't know.
You already have this money, or is this funding within?
We've got half the money so far.
Okay.
The first year's payment is sitting in our account, and we're trying to determine how we're going to spend the monies, have the master plan on how it's going to be spent. So we can draw interest on it for little, that is. So then we've got the Nature Center project. Robert, you want to talk about this one?
Yeah, the Conservation Board about 7 years ago started discussing the idea of replacing our current offices, which are out at Fort Park. And if you've been around here long enough as kids, you probably were out at Fort Park or you've been there since that time. We're in an old building that is was a family cabin from back in the 40s. It's not handicap accessible. Been added on to many times. So The idea started moving forward, in 2017. The Conservation Board hired an architect, started working on the plans for the building, and we came up with the current design we have. The location was probably one of the things that the board settled on first, we agreed upon, was it's about as centrally located in the county as we could get, right on the corner of Highway 9 and 69. You've got about 2,000 car a day traffic count there. It's within about 10 to 15 minutes of 90% of the population of Winnebago County. We've got the 50,000 people in surrounding counties around us that are within another half an hour or so. So we think that location really fit well. It'll serve the communities and the schools and the public well. We started raising funds in late 2018, started writing grants. We did a mass mailing in 2018. And our goal was about 1.3 million. And based on our architecture's estimates and some of the other projects that were going on around the state, that should have taken care of our building. It was about 700 square feet on 2 levels, 40 by 96. Behind you, I've got some diagrams there if you want to look at them on your way out. But many of you drive by that corner on a regular basis. You see our sign. It was hoped that several years ago we would have started construction. And COVID was just kind of coming into full speed when we let bids last January 28th. And the bids were nowhere near where they needed to be. And all of the contractors were citing that the unstable cost of materials. We waited a year. We've asked our architect to do some value-added engineering. We've changed some of the design. The footprint is still the same. The square footage is the same. The room usage is the same, but we're going with some less expensive construction methods to get the building in that $1.9 million area. We think that this type of a building is going to, first off, be used by the communities, by the schools, but it would also become kind of an anchor and a destination for folks from the surrounding areas. People that are looking at moving to Winnebago County, of Forest City, and all the other communities, they look at the quality of life and what's there for me to go to Lake Mills or the Buffalo Center or Forest City or wherever. Why do I want to live there? What else is there for me to do? And I think this just adds to the quality of life of Winnebago County. And if you look around the state, I think there's 75 counties that have nature centers. There's about 10 more that are working on them, but we've got plans to put it in place. It would house, we'd have 2 small offices in there. We'd have an auditorium that would seat about 85 people. We'd have a violent exhibit. We'd have an activity room in the lower level for naturalists to work with kids. We would also have it available for civic groups, clubs, professional groups that want to have meetings there. EMS can have all the meetings there they want. It's in a central location. I'm not joking here. I think that was something we could probably do. And other professional groups and clubs that want to meet a place, and possibly for family gatherings too. A lot of the nature centers around the state will have anniversary, birthday parties, that type of thing. So that's not something that wouldn't be a possibility. Our Conservation Foundation was actually started our Friends group 10 years ago now. It's hard to believe, and they've been our fundraising arm for these 7 years. So a lot of the grants have gone through, and the money is setting in their bank accounts. And the foundation will continue to exist after this building is built. It's going to be a higher energy efficient building, so our maintenance and utility costs will be lower. But there's always going to be costs. We're going to have exhibit costs and upkeep. And with other nature centers around the state, they normally have some kind of a foundation or group, a friends group that has stayed on and served as a fundraising tool, and we work together. And so I think that if we can get a building like this in the middle of the county, it's going to enhance our county. And we've had really good support from people within our county and from people that have lived here in past years that have memories of Winnebago County that have ran and sent checks, and we continue to receive some of those. But during COVID, we kind of tapered our fundraising efforts until we could come up with a better number as far as an estimate of construction costs. And our architect is currently working on bid plans, whether they be let this spring or later in the year, that's yet to be determined. But, so we've asked the Board of Supervisors to consider providing some of that ARPA funds to our project so that we can go ahead and let bids and possibly move forward with this project with this spring. That's it.
All right. Then we'll move on to EMS Infrastructure Funding. We don't know what the advisory council is going to come up with, but it's in the queue in case there's some needs there or something. Some of it is acceptable. I'm not sure on the training if it's acceptable, but I'm sure there's some way we could rob Peter and pay Paul.
I don't think training is, but I think everything else is.
Yeah, but the rest of it is all acceptable expenses, so that's why it's in there, just in case something.
Quick question for you.
Yeah.
Why are they so expensive? What makes them? I'm sorry, I don't really know, because I don't really work with ambulances, but is that like a standard fee for like an ambulance? Like,
You can thank the insurance companies
okay,
and Medicare for the expense of them, and, just for point of reference, Lake now bought, thankfully, Life Tech was doing a buy one, get one, half off, or buy one, get one free on monitors. But otherwise, they would have been $38,000 a piece for our cardiac monitors. Our glucose devices are $14,000 a piece. We just put in a new power cot that was $19,000. Because the equipment is expensive because it's medical equipment, and our rates are that way because of insurance. We can't charge, so AJ, I can't charge you $10 for an ambulance ride, and I can't charge, and then Nathan, I charge $20 for it. We have to, because then we're in Medicare fraud and insurance fraud, and so everybody gets charged the same clear across the board.
thank you.
I talked a little bit about the document scanning in the courthouse, and we would want to make it in a searchable format so it's easy to find, whatever document. But like I said, it's not a large dollar number on this. It was just part of it maybe fill in money or whatever, but these are necessary things. We have done some scanning over the years, but it'd be nice to complete the scanning, so. And then in the courthouse, we've got the main boiler for the old building that's getting up there in age. That gave us problems over the last year. First meeting of the year was the day that everybody came in and wore their coats because there was no heat in the building and it took a while to get it there. What was the temperature in your office?
32 degrees.
32 degrees in our office. So it does have failure. At that point, it was a electronic board or something.
It was in the computer end of it.
Yeah, but the boiler itself is getting very old, and the one in the annex is also getting up there in age. And we have coolers that circulate cold water in the summer, and I know at least one of those is not holding its charge. Yeah, if we don't repair it, we should replace it. So those are some of the things we've identified. And also asking you all, where do you think our priorities should be?
I'd like to know where some of these things that they're due to COVID mitigation issues. The money is supposed to be used for COVID to help us get back to normal from that, or, I mean, I have the things that this money is supposed to be used for, public health response, negative economic impacts, water, sewer, and broadband. These building costs are not water, sewer, or broadband.
We don't have water and sewer in the county
I'm just
for
thinking,
us.
like, how is this COVID related? How is the conservation building COVID related?
Outdoor recreation, people are outside, away from each other, good for mental health. Also keeps them distance from one another, and they enjoy the outdoors. So that's That's where that comes in.
This money is supposed to be used to replace the revenue loss in the county from COVID. It can be used for premium pay for essential workers, as nurses that have been out in the field, going into COVID homes.
The deputies and sheriffs, the EMTs, the firefighters, pretty much anyone that has been going out into the public.
The COVID testing that we did, wearing head to toe tie-dye suits, 90-degree weather. This can all be retroactive for premium pay and the water sewer and property. Like, some of these things are not openly related.
Our external auditors don't believe in bonus pay, so that's something that we have taken off the table because our external auditors have said no bonus pays. So we are not gonna do that
If the state says, if the federal government says you can, why not?
because our external auditors, the ones that audit us, say that that's not a proper use of our funds. And we have to go by what we're said that we pay people, and we can't pay people more than what we say that we're going to pay people.
Who are the external auditors?
Gardner Thompson, SH.
So I guess my question is then, are the external auditors okay with spending on, because, yeah, according to my information from the U.S. Department of Treasury with the final ruling dated January of 2022, that goes into effect of April 1st, you know, general buildings are not approved. I mean, we want to talk about infrastructure for the water, the sewer, the broadband, great. I mean, EMS needs a building, we need updates at public health, the conservation building, that's a great thing. But we also can use it for getting an ambulance. We can get it for equipment for the EMTs, you know, talking about raising the taxes for the people of Winnebago County and the suffer, you know, all the issues with EMS. Why not take this money and put it into something that should have been deemed an essential service years ago, but through the fault of what society has allowed healthcare to become, which is the very bottom run, and manufacturing retail takes more precedent over taking care of people. Let's take this money and actually put it to use with the people who actually were affected with COVID. The people that actually their jobs and their lives have been crappy for the last 2 years because things have completely changed for them with COVID. Because not everyone's job has changed with COVID. Yes, in little bits, but EMS, deputies, sheriffs, firefighters, nurses, healthcare, Good Sam, Lake Mills Care Center, everyone in healthcare, everyone who's had any interaction with the public, their last 2 years has been hell. I would be willing to bet money, probably 95% of them have had a mental breakdown in the last 2 years. And I'm sorry that you want to spend money on a building, on buildings, let's put it into actually helping the healthcare system.
Well, isn't that what the public health building is? That's healthcare, right?
Yes. Yes, but it's not allowed according to this ruling.
This.
Under what?
Side question is, you were just talking about restrictions that were imposed upon you by your external auditors. Internally, within Winnebago County, is there anybody stopping you guys from spending this money however you see fit? There's no internal, like, you guys have the money, you can spend it however you want, right? You don't have to ask us, the public, how to spend the money, right?
That's why we're here.
No, you don't have to. You can decide.
There's no vote.
Right,
You can
but,
set your priority and.
yeah, we
okay,
can.
The courthouse needs a new air conditioner, all right?
We've already ruled that out.
Well, it's on the list.
It was in the committee discussion.
There is one thing that we have learned at the radio station that is coming down starting March 4th. Some paramedics in other counties are probably going to have to lose their jobs because they're not vaccinated by March 4th, and certain health organizations will not allow them to transport those people into those buildings unless they've gotten the jab. We're facing that crisis as well too, potentially even here in Winnebago County, if some of our EMS people, and we not need to take names because of health privacy issues, but those people may have to bow out as well too because of this. So this crisis that you're talking about, based on what we're getting as far as our stories are concerned, is happening a lot faster than your referendums that are coming up here very soon. I mean, March 4th, that's it.
I don't know a lot about that. Do you have to be an employee to have that mandate, or?
No, the organization that is mandating this is saying anyone who walks in as a vendor or emergency services personnel has to be vaccinated. And the medical records have to be proven.
They have to be a contracted vendor, or if they're regular volunteers, then they have to be vaccinated. And they're seen as
And this is a federal mandate that's coming through. So just to throw that out there for y'all's consideration, because we're running into a situation at the radio station now as a result of it.
How has it affected the radio station?
Because they're advertisers.
It's pretty far reach.
They're going after everybody.
Sounds like fun.
I personally put trust that the supervisors are going to spend the money on what they feel is best needed, because that's why we elect people to make those decisions. But just to speak to the healthcare crisis and all the education I've done being in healthcare and working through this crisis, for what it's worth, I do think that we are at the beginning of a healthcare crisis. Clearly, the meeting that most of us are here for is to discuss EMS and the lack thereof. We're only going to see more of that. The one thing I would like to say again, just besides an appreciation for healthcare workers, EMS, firefighters, people who were told when the rest of the world was told to go home, we're told that you have to go to work or you lose your job. It was very exhausting for people. And we're seeing people leave healthcare and in all capacities in droves. If there is an option to do anything to benefit and nothing is about financial, but I will say that it not hurt my heart a little bit when I worked more than I've ever worked in my life during a crisis. And in turn, there are people who are getting paid $700 to be at home. So there's a lot of resentment and maybe feelings of not appreciation. People don't stay at jobs because of money. They stay at jobs for appreciation. And maybe I would just hope that the supervisors and the community would look at how can we appreciate the people who did stick through it, who are staying with it. And I understand there might be internal auditor issues, but I would really challenge you to look more at that, because I don't know a healthcare worker in the United States who hasn't received some sort of financial benefit or compensation from their employer. And essentially, the county is an employer. So
They have not received anything.
And I don't think anybody is looking for money. I think they're looking for the same appreciation. If you work at Winnebago and you work extra hours and you're a great employee, you're going to be financially compensated for that. I think it's just is sending a message that we care and we value, and that maybe could be done through financial compensation, especially through the funds that maybe were made to compensate people who are putting themselves as essential workers.
I feel like a lot of people don't realize on our level what we do go through, what we have been through. Everybody else is locked up in normal road, and it's a little reality check.
We just submitted a publication yesterday. We have to go in head to toe because the hospitals can't hold them that long. And we have to go in and make sure that they're okay up there and that they're safe, and make sure that they don't need to go back to the hospital. That's head to toe PPE. We need the equipment. We are taking our equipment, our blood pressure cuffs, our stethoscopes. We are doing assessments on these people.
And then we're taking them out, wiping them off the box sites, going on to the next patient. We need more equipment.
Definitely.
We're putting our health at risk. I just had COVID 2 weeks ago, that's why I'm wearing a mask. And, I mean, we are on the front lines of this still. It's not gone away yet, even though everyone's opening out and doing everything. It's not gone.
And when we're doing vaccinations, we don't get to go home and eat supper with our families. We're out doing vaccinations, getting the ambulance crew vaccinated. We don't receive anything extra for that. We're just told, go do it. Shut up, it's your job. It is,
That's
it's
the
not
ones who
true.
like us ambulance group and give you guys all your shots after work, after hours. We're doing COVID clinics nonstop. Julie is busting her butt trying to get COVID clinics scheduled for us during the day. We all take turns doing this. And we have patients lined up in our hallways because they have to be 6 feet apart. So we have them in the lobby, we have them in the hallway, we have them in our back meeting room. Because they have to wait 15 minutes before the next, to make sure they don't have allergic reaction. There's no space for them. And then we have a foot clinic come in because the elderly people can't reach their feet. And we have to put them in another room. It's just not.
Sorry. And our secretary, she's put in extra hours too, inputting all the data that we have to put in after we give all these immunizations and keeping track of everybody's records.
We've gone to the industries around the entire county, and those all have to be put in within 24 hours. So Julie and Victor have gone with us to these vaccination clinics, putting in all this data within right there and there because it has to get done. We have regulations that we have to accommodate. We put in a lot of time, and we're not allowed overtime or com, or we're maxed out on our com. We're not.
A lot of departments have reduced their access in the last 2 years. Not every department in the county has. And I think that's sometimes forgotten about. Public health hasn't, sheriff's department hasn't. I mean, EMS. So it's frustrating as a collective. I guess I don't talk to any of sheriff departments, but I would assume that you guys are probably frustrated seeing.
I'm sure they go on enough behavioral health calls now. The behavioral health, mental health of this county is horrible, horrible rate. People are scared to death to leave their homes. We have to beg them to go to their doctor's appointments. I'm sure they've gotten more calls for mental health issues than they ever have.
Probably a few statements.
Thank you. They deserve pretty employee too.
Any other comments from,
What is your timeline or when do you plan to take action with the?
I don't foresee us doing anything quick. I mean, I'm sure we'll make it through all these public meetings throughout the county with it. There may be one or two things that may be indicated to get started. We have up until 2026 to spend all the money for the ARPA.
24.
20 what?
24.
24?
25.
I was thinking at least 25. So we have some time. We want to do our due diligence and decide where it would fit best. So, all right. Well, with that, I guess I want to thank you for all your input and your time spent here tonight. And it's, I think, well invested. We're going to keep doing this and starting that just by taking action tonight to start the process. We'll continue the conversation around the county and keep moving on it. So, what's that?
The next meeting. Have you set that yet?
Did we set it the other day at the meeting?
Yeah.
We were looking at the 24th. Was it available? We're staying away from St. Patrick's Day, and we're gonna go to the next Thursday after that, right? The 24th. We gotta make sure the room's available. That's the one we talked about anyway. You wanna call it, Susan? Susan, call it. Or adjourn. I wasn't here when they set up. Yeah, turn around. Chase that little mouse. Let me just close this.